Is it wiggling?
I think.
It's thick.
It's thick. Oh, yes, it is thick. What I want to do is, we can see here there's an ulcer, and I know that your toenail is affecting that. So I believe it's hitting the shoe, and it's causing cracking here underneath the nail that's now got infected. So what we're going to do is come on top here, and if any redness goes past this line, you see any streaking or anything like that, I want you again to go to the emergency room. Any nausea, vomiting, fever, chills, diarrhea, go to the emergency room, okay? Because I just don't want this getting into your into the blood over the weekend.
Not med first, but the emergency room.
Correct. Okay, good pulse, strong pulse on the top of this left arch here. Can't really feel good circulation in the other locations, but that's pretty typical for the more birthdays you celebrate.
Yeah.
Like how I said that? So I'm just gonna go ahead and start trimming up some of this, and we can kind of see what's underneath. Sadly, a lot of times they're larger than what we can see under the surface. Not a lot to grab here, is there? Let me go ahead and trim that nail. It's in my way. So, is it wiggling?
I think.
It's thick.
It's thick. Oh, yes, it is thick. So I'm going to go ahead, get this little guy. Have you noticed any drainage?
Well,
It looked like it was bleeding.
And that's from the pressure. And speaking of the pressure, the reason it's in this location is because the toe is bent. So every step you take, the tip of your toe is rubbing the floor.
I noticed that.
Yes, and so where you don't have good sensation, you are wearing a hole or an ulcer in the tip of the toe because you just can't feel it like we can. So the first thing I want to do is get you a boot or a shoe to take the pressure off temporarily, because every step you take, it's wearing. So I want to eliminate any pressure to the area so it'll heal up much faster. And we're definitely going to put you on an antibiotic because that's not helping our healing at all. Do you have any allergies?
Penicillin.
Penicillin, okay.
An old one.
I'm going to call you in something called doxycycline, which is a very effective, safe antibiotic. Let's go ahead and trim up some of, and we'll go ahead and trim these too. Oh, look at this one here. This one's bent as well. What I think we're going to do is discuss more of a permanent measure, because I know if we leave this toe in this position, it will continue to come back over and over and over. So what I would recommend, again, it's bent. There's a very minimally invasive procedure that can be done here. We basically numb the toe, and then there's a small tendon that we just clip here and really release the capsule, and anything that's pulling it down, and then we splint it in a way that it stays straight for 1 week. You don't even need a stitch, it's so small.
What about the others that he's walking on?
That's what, yes, I would, definitely this one, because we've got a big callus over here. I do want to heal the callus prior to, and obviously get rid of the infection prior to anything like that. I see a little bit of drainage on the bottom, to really just to the base. It's a serous drainage, actually. Why does it feel dark in here? I don't know. I know, I saw that. So what I'd like to do is, if you look at the base of the ulcer, it's got a bit of yellowing to it. That's called fibrous tissue right in here.
Okay.
We are going to prescribe a medication called Santal. Santal is really going to help eat away at that buildup, because the fibrous tissue impedes healing.
Okay.
I want this ulcer to look like a steak, hamburger meat. When it looks like that, it will heal the fastest, because that's good, healthy tissue. The fibrous tissue is just in the way. Okay? And the Santal, I'll have the girls tell you, because it comes from a specialty pharmacy, I believe now. Isn't that right, Ashley?
Yes.
Okay. And we want a little bit of bleeding because, again, that's how we heal. So nothing there to culture. And I'll get you some measurements, Ashley, in just a moment. Give me just a second. I want to finish. This is just such hard skin here. You know, when's the last time you had your feet measured?
Never.
Never.
Well, not, we've been married 56 years and he hadn't since I had him.
Well, I just want to make sure that we're wearing the appropriate size shoe.
Okay.
Okay.
The shoe that I'm wearing is
The Skechers there?
Yeah.
it's
Yeah.
a couple of sizes.
No, I don't know that it's
So you
that
have
much.
a mixed fibrotic granular base. The depth is about a 0.5 millimeter. And I'll get you the other measurements. It's just kind of all this dried, bloody skin in the way. Clean that up. When did you first notice this?
Well, it's been about 2 months. He
2
came
months.
to me and said, look at my toe.
Okay.
He hasn't been showing me his toes or nothing, you know, just taking care of business.
Mm-hmm.
And I looked at it and almost fainted. He cut his toenail and he cut the tip end of his toe with the toenail on the clippers.
Oh, wow.
And I
The
said,
truth shall
Yeah.
set you free.
I said, how in the world? He said, well, I thought I had the nail and the toe was right there, so he cut it off.
Yeah, alrighty. That makes sense.
That's when I took him to the Baptist Health, Med First, whatever.
Med First.
And they x-rayed it and put him on a antibiotic and a cream. So he took that, it's 7 days, and then the cream. We've been using the cream, but
Well, we're going to change that up with a little bit of that Santal. I would love to get a hold of the place that was treating this or where you visited prior to, get those notes.
okay.
That would be good, just so I can kind of have everything in one location.
Yeah. it
There
was
are, if
Baptist Health on Nicholasville Road.
okay, we'll have them sign a consent to get that on the way out. So we've got 13 millimeters by 14 millimeters. Have a fresh gauze, please. And then I'm going to go ahead and trim this callus and grab, thank you. I'm just going to kind of put that there and tilt you up a bit. Going for a ride. There we go. So yeah, I'll go ahead and get a hold of this guy too. And this is very obvious how it's, you know, bent, and it's the hammer toe. So distal right second, hyperkeratosis. Boy, those are just so hard. One of the other things I'm considering, and once I look at the notes, you know, the longer a wound is open, the more likely we are to get a bone infection. So we want wounds to close up very, very quickly.
It's been a while.
It's been a while. I'm going to, as soon as I can get a hold of those notes, I'm going to submit a request to be able to put a very, it literally just applies to this. It's a graft. It's a skin graft. It's not your skin. It's somebody else's skin.
Not mine.
Right. Not mine
All
either.
mine
No
away.
way. But we just attach it once a week and it heals it up at a rapid rate.
Okay.
Yeah. Again, we got to get rid of the infection first.
Yeah.
Can we make a note of that, all that in his chart, Ashley, that we want to get those notes and we want to consider doing the skin graft as well.
Okay, now what?
I just quit taking that medicine for infection.
Yeah.
You finished it though, right?
But Dr. Winchester, I went to him like the 18th,
Mm-hmm.
18th, and he prescribed a prescription for that infection.
Yes.
So,
Do you?
but he's taken all of it.
Okay.
It was 3 yellow capsules,
Mm-hmm.
3 times a day.
Yeah.
Well,
Probably like, well, you said you're allergic to penicillin. I don't know what it was. I like doxycycline because it's safe for your kidneys. It's a very effective antibiotic for.
That sounds like it might be it, but I don't know.
Did it look better after You
Yeah.
started? Yeah.
Yes.
Good.
It started bleeding a little, and up until that point it hadn't.
Relax that toe. You're holding on to it tighter than I can move it. So we can actually see here, it's almost like a center of glistening white. That is actually very close to getting deeper into the skin. In fact, there's a bone right underneath, and it's just a fragile area.
That's what I thought he'd done to his toe, the big toe, when he showed me. I thought, oh.
Let's grab a toe crest pad for the right foot to pull that up off of the ground before it becomes a problem. Just going to trim your nails here, and they'll come in and smooth that down in just a moment when we're done. And get you lotioned up, and then we'll also get this dressed up as well. Kind of protect that a little bit from here. Boy, does this toe over here hurt?
No.
All right, let me have your toes. You're pulling it.
No, it's always crooked and always.
That's why he wouldn't let me see his toes.
Well, I'm gonna get the length and the bulk trimmed down as much as possible, but we'll smooth everything down when we're done. Okay, pop over here. Then, okay. These aren't too bad over here. These are nice and thin. Oh my gosh, I know you guys are gonna comment on how I trim toenails. If I do it this way, your hand gets weaker.
Oh.
The palm is stronger. Every time we do a video, no joke, there's about 20 people that say, why do you hold your instruments like this? This is actually the way that my grandfather did it, and he was taught in the 60s or 50s on how to properly trim toenails. I mean, he was a podiatrist, and that's who taught me. And I don't know if the technique has been changed. I doubt it, but stick with what works.
That's right.
Okay. All right, gang. Well, let's get all this cleaned up. I'm going to have the girls come in and kind of recap. We've got a little cheat sheet for you over here. You're always welcome to send pictures via text. You can text us. The emergency line is open all the time if you're a patient, of course. And I can talk to you this weekend if I don't have anything going on. So if anything for the holiday weekend comes up, you're welcome to call me. Okay?
Thank you.
You're so welcome. Great meeting you guys.
Good seeing you.
All right, guys, I hope you learned something today. Don't forget, like, any callus can turn into an ulcer just like that. So importantly to get it offloaded, to take care of it, and more importantly, call your podiatrist. I'll see you next time.